Can you take iron with levothyroxine? Yes, you can. But only if you space them out by at least 4 hours. And here's the part most people miss. This isn't a dangerous interaction. It's a sneaky one. Take them too close together for long enough, and your thyroid medication quietly stops working as well as it should. I'm Steve, a pharmacist at LiveHealthyRX. On this channel, I break down supplement and medication interactions using real evidence, not clickbait. So, let's talk about why this happens. When you swallow your levothyroxine and then take an iron pill within an hour or two, the iron physically binds to the thyroid hormone in your stomach and small intestine. The two stick together, and that complex is too big for your gut to absorb properly. The result is that anywhere from 30 to 50% of your levothyroxine dose can fail to make it into your bloodstream. Here's what makes this interaction different from a lot of others. You don't feel it right away. There's no nausea, no headache, no warning sign. What happens is your TSH slowly drifts up over weeks or months, and you start feeling the old hypothyroid symptoms come back. Fatigue, weight gain, brain fog, cold hands. And because nothing obvious changed, most people assume their thyroid got worse or that their dose needs to be increased. The real culprit is timing. This matters even more if you fall into one of a few groups. If you're treating iron deficiency anemia at the same time as hypothyroidism, you're stacking two conditions that both cause fatigue, and you really need both medications working at full strength. If you're pregnant or trying to become pregnant, your levothyroxine needs go up, and case reports describe patients who needed dose increases purely because of timing problems with iron. And if you're on higher iron doses, around 45 milligrams a day or more, the binding effect is more aggressive. So here's what to do. First, take your levothyroxine first thing in the morning on an empty stomach and wait at least 30 minutes before food, coffee, or anything else. Second, take your iron later in the day. Mid-morning with lunch or in the afternoon, all work fine. Just keep that 4-hour gap. Third, be consistent. The interaction isn't about a single dose. It's about what happens day after day when the spacing slips. Pick a routine and stick to it. Fourth, get your TSH checked a few weeks after you start iron, especially if you were already stable on your levothyroxine dose. If your levels have shifted, your doctor can tell whether it's a real dose issue or just a timing issue. The bottom line is this: iron and levothyroxine can absolutely be taken together. The fix is a 4-hour gap, a consistent daily routine, and a TSH check if symptoms come back. It's one of the most manageable interactions in pharmacy, but only if you know it's there. The full guide with references is on LiveHealthyRX.com. Link in the description. If this was helpful, consider subscribing. I cover these kinds of supplement drug questions every week.